ADHD is present in about 5 to 10% of children and adults. Whereas many children with ADHD are diagnosed, most adults are unaware and not treated for their ADHD, despite struggles into adulthood. Today I'm going to talk about what is ADHD, how do you diagnose it, how do you treat it, and give you hope for you or your family member or loved one who may be struggling with this. Attention deficit hyperactivity disorder is a condition that involves inattention, hyperactivity, and impulsivity. These can manifest in different ways at different times in life and in different people. All children and adults have times where they may be inattentive, hyperactive, and impulsive, but these behaviors are more severe and occur more often in those with ADHD. To be diagnosed with a disorder in children, this should have been present for at least 6 months or more and occurred by age 7. And in adults, symptoms, although may likely not have been recognized as ADHD, looking back, were present by age 12. Symptoms typically have been present for a long time, but may not have been recognized in children if they've had a high IQ or were less hyperactive and just inattentive. It is clear that there is a biological basis for ADHD. It appears from studies there seems to be an imbalance in dopamine, which is a neurotransmitter or chemical signal between brain cells and neurons. If one parent has ADHD, there's about a 50% chance that one of their children will have ADHD, and vice versa. If there's a child that has ADHD, it is likely that one of the parents have ADHD. Most likely those parents would not have been recognized because it wasn't commonly diagnosed or recognized when they were younger. What are the symptoms of ADHD in children? Symptoms of ADHD in children include inattention, such as being easily distracted, missing details, forgetting things and frequently switching from one activity to another, having difficulty focusing on one thing, becoming bored with the task after only a few minutes unless they are doing something enjoyable, have difficulty focusing attention on organizing and completing a task or learning something new, having trouble completing or turning in homework, assignments, often losing things like pencils, toys, assignments needed to complete tasks or activities, may not seem to listen when spoken to, may daydream, become easily confused and move slowly, have difficulty processing information as quickly and accurately as others, struggle to follow instructions. Children with hyperactivity may fidget and squirm in their seats, talk nonstop, dash around, touching or playing with anything and everything in sight, have trouble sitting still during dinner, school, and story time, be constantly in motion, and have difficulty doing quiet tasks or activities. Children with symptoms of impulsivity may be very impatient, blurt out inappropriate comments, show their emotions without restraint, and act without regard for consequences. They have difficulty waiting their turn for things where they have to wait. They often interrupt conversations or other activities. Parents and teachers can miss children with symptoms of inattention who have ADHD because they often are quiet and less likely to act out. They may sit quietly seeming to work, but they are often not paying attention to the teacher or not able to stay on track with homework independently. They may get along with other children, whereas children who have more symptoms of hyperactivity or impulsivity tend to disrupt class more and often are recognized. Children with ADHD who have a higher IQ and are polite are often missed as well because they are able to read, sound out words, do phonics, above average, but have a hard time retaining what they read and have to reread often. Many falsely assume that they are bored and not challenged, but when their ADHD is diagnosed and treated, they do very well. Most of those who have gone on untreated have been told by many teachers that they could have been better in school if they had just applied themselves. Many students may become frustrated or anxious about school and start to give up. My opinion, by 4th grade, if it's not recognized and treated, many children start to give up on school. One of the saddest things I hear is a child who says, I don't like school consistently. But if you can't focus, you have a hard time paying attention, and a lot of work involves sitting, reading, and you can't pay attention, who wouldn't get frustrated? Many have similar kind of problems as children, but they manifest in different ways. At the core are the same symptoms of inattention, hyperactivity, and impulsivity. Adults with ADHD who have inattention may struggle with reading, especially informational reading. That doesn't mean they can't do phonics and sound out words, but they have to reread things multiple times in order to retain what they read. Things like reading textbooks may be a big challenge, or reading through instruction manuals. They may enjoy scanning through magazines or reading more action-adventure novels or romance novels. They may have struggles with organization. Delay getting started when trying to do something requires a lot of sustained mental effort. Hard time paying attention when doing boring or repetitive work. May listen poorly, often interrupting someone when they are talking. Lose important things needed for activities. Get easily distracted. Be forgetful in daily activities. Adults with ADHD who have symptoms of hyperactivity may feel anxious, but not necessarily depressed. One of the most common symptoms adults with ADHD come and see me for is depression or anxiety that may not have been fully treated or resolved with typical anxiety or depression medicines. Sometimes I've had patients who, when put on depression medicines or anxiety medicines, but they said they never really felt necessarily depressed. They may have felt anxious, but they were more frustrated. Adults with hyperactivity may fidget his hands and feet and may feel like he has to get out of the chair a lot, although out of respect they may sit and just be restless in their chair out of politeness. They may feel restless and always have to be doing something, have a hard time sitting and relaxing, always feels like they're on the go. Adults with ADHD may be louder than most people. Adults with ADHD with symptoms of impulsivity may blurt out answers before waiting, have trouble waiting their turn. They may be in a grocery store and have no particular deadline or a date or time they have to get home, but they get frustrated if they're stuck in the long line because some person has to get a price check or get coupons checked, and it just gets frustrated even waiting in line. They may interrupt others. Many actually have addictions. One way the impulsivity side of ADHD shows is with addictions. For my years of treating adults who have ADHD, many have some kind of addiction, partially used to cope with the ADHD, with the exception of exercise. They may have an illegal addiction like opioids, cocaine or marijuana. They may have a legal addiction like alcohol, nicotine, pornography, or food. Many exercise a lot, but when something happens in life, like they go to college and no longer are training for a sport, have an injury where they can't exercise often, or start a sedentary job, they may develop significant restless or anxious symptoms. Is there anything good about having ADHD? Good question. There's a lot of negativity about having ADHD. Many people, when they hear of ADHD, get very defensive because for years it's been synonymous with being lazy. The disease or problem may be thought of as being made up and not that real. But there are some things that ADHD does help with. Being inattentive, in a sense, means having a hard time focusing on something. But the opposite of focusing on one thing is that they think about a lot of things and often have lots of ideas that go through their head. This is called being creative. Hyperactivity can have a positive side because many people who have ADHD just naturally love to exercise. They've always enjoyed exercising and may have made comments that if they don't exercise, they just don't feel right. They're just almost compelled to do it. Impulsivity also can have some benefits. Now, being impulsive can often mean addictions and other bad behavior, but it also can be impulsively starting a business. Taking a risk. That's a good thing in many ways. The word entrepreneur means risk taker. Diagnosis of ADHD, like anything in medicine, particularly psychiatric medicine, involves an interview of both the patient and their family and friends and loved ones. ADHD rating scales are used to help assess their impairment compared to other people of their same age. A 5-year-old is going to have a shorter attention span than a 15-year-old. That is adjusted. The other pattern is that it isn't just the 5-year-old kindergarten teacher, but it'll be the first grade and the second grade teacher who all are noticing similar things. It isn't just one parent, but both parents are going to be noticing significant struggles, for example. Again, this is a diagnosis that the symptoms are present by the time they're 7 in most children, but it might not be until age 12, especially if they have a higher IQ. Many children who have higher IQs, who are polite and more inattentive and less hyperactive, may not have recognized that the procrastination they had was a problem as long as they got good grades and didn't get into trouble in school. ADHD treatment is a lot like needing glasses. When I was in 5th grade, going into 6th grade, that summer I made the all-star team for baseball. Now, humbly speaking, I have pretty good athletic ability. That fall, after that summer of baseball, they lined us up in the gym during recess and had us do an eye chart. Now, the interesting thing was I couldn't see past about 2150 and 2200, which means I was legally could never have driven a car. I didn't know I had a problem. Like many people who got glasses for the first time, I was amazed at how much detail I was missing out on in life. I don't know how I hit the ball or how I caught pop-ups, but my reaction time was able to adjust. Now, although I didn't play any major league sports or even play in college, if I didn't have glasses, my ability to be successful later on in sports without seeing the ball would have significantly been impaired. Now, in the same way that glasses help somebody focus so that they at least can function, so they can hit the baseball or see the ball, allowing them to hit the ball, medications that treat ADHD allow somebody able to focus and concentrate. The medicines that are most effective are stimulant medications such as methylphenidate, which is generic for Ritalin, and Adderall, which is a medication that works in a similar way as Ritalin. Now, why would you give a stimulant to somebody who has problems with hyperactivity or inattention? Because what is being stimulated is the part of the brain that is not able to pay attention or stay focused. There are a couple other medicines that have been used in ADHD but are much less effective. Bupropion is a medicine that's mainly used with depression that has helped and often use that as a first line in somebody who has depression and ADHD. There also is amoxicillin, which is generic for Strattera, which has small benefits, not nearly as effective as the other medications. Now, some people wonder about, do we really need medications? Well, in a sense, we don't necessarily need glasses. And if you're paying attention, I don't have glasses. I have laser surgery done years ago. But we don't have that treatment for adults or children for ADHD. There's nothing besides the medication that can treat the symptoms. Now, everybody will benefit from one-on-one tutoring and teaching and all of the other ways that somebody can learn something. Without the glasses, you're going to be significantly impaired and will, except for a few highly gifted people, will not be able to compensate well enough, or they will have restrictions on what classes they take and won't take classes that require a lot of focus and concentration. Diet has very little role with attention and focus problems. People have brought up sugar and other things. The reality is just eat healthy. You shouldn't eat all excessive refined carbohydrates, with whether you have ADHD or you don't have ADHD. But it doesn't say that sugar is going to make kids with ADHD behave any worse than those who don't have ADHD. You should be able to read and retain information much better without having to reread as often. You will likely be able to be more efficient getting your work done. You'll be more organized. You will listen much better in class. You won't procrastinate like you used to. You will likely feel more relaxed and less restless. You will likely be less impulsive. If you have an addiction, you will likely have fewer cravings. For example, studies have shown kids who are not treated with medication for ADHD are 3 times more likely to start an addiction like smoking than those who are treated with medication. Many parents and family are concerned that kids with ADHD are more likely to develop an addiction, and that this medication to use to treat ADHD can be addictive. The interesting thing is, when they don't take the medicine and they're not taking the medicine, they're actually more likely to get addicted to other things. They will listen better at home, school and work, and will be able to work more independently. They will be able to stay on task much more effectively. The side effects are usually minimal unless the dose is too high. I usually try to start someone on a lower dose and increase the dose until the symptoms are treated, and there are few, if any, minimal side effects. There may be some dry mouth, decreased appetite, which may result in some weight loss. If taken near bedtime, it may keep you awake. Others may notice that you seem more serious and quieter, but this is because you are likely listening better and not as loud, and don't blurt things out as often as you used to. 80 to 90% of the time, Ritalin or Adderall works about equally effective. About 15% of the time, one may be more effective and have less side effects than the other. This is meant to be a brief overview. In upcoming videos, I'm going to be talking about the connection between ADHD and restless leg syndrome, along with depression, anxiety, as well as chronic pain. Hope you enjoy.